MDNews Network recently attended the Medical Group Management Association's annual conference in New Orleans, where our cameras focused on attendees with opinions on everything from healthcare reform to healthcare technology. Here's what they had to say.
There's a lot of agreement amongst employers, hospitals, health plans, and physicians about the fact that the system is changing. Beyond that, there's a lot of disagreement about exactly how it should change, what we're likely to see as the end game. But to me, the message is anybody who's standing on the sidelines saying, I'm going to continue to do tomorrow what I did yesterday, is in for a rude awakening. And we're seeing a huge amount of consolidation of practices, lots of changes in how payers are looking to pay for care. So if I were out there in the practice world right now, I'd be trying to figure out how can I, as a physician, make my practice part of this new era and continue to practice medicine. I mean, there's probably been more change in the last 5 or 10 years than in the previous 15 or 20. But the big trends, in my view, are the huge shift in away from physician-owned practices towards physicians as employees, sometimes as employees of other physicians, but increasingly as employees of hospitals or multi-specialty practices, integrated delivery systems. That's a very different world than when I started. Along with that, I think, has been the growing expectation that regardless of what kind of practice you're in, you have some personal and organizational responsibility and accountability for quality, for safety, for patient satisfaction. Used to be you could kind of go out and practice as you were trained and nobody was looking over your shoulder. Today, a lot of people are very interested in knowing how does your care compare with everybody else's care? And if you're not doing as well as other people, you better improve or else. Well, there are a couple of things that kind of stand out in my mind. One is, on the one hand, from a public policy perspective, you've got high-tech incentives and ERA trying to encourage people to adopt EHRs. Great idea. We're fully supportive of that. But then on the other side of the coin, you've got the sustainable growth rate formula that's proposing a 30% cut in Medicare payment rates. If you do the math, for most practices, the 30% cut far exceeds the incentive money that you could get for implementing an EHR. So you don't have to be a wizard to say, I think maybe I'll sit on the sidelines for a while and see what happens on this underlying cut. And I think that's what's going on with a lot of practices now, particularly smaller ones. They're very reluctant to even try to qualify for the incentive money until they see what's going to happen with their basic Medicare rates. The other thing that really kind of struck me was how many practices said that they would close completely to Medicare in the event that the cuts go through. And it's not just, I'm not going to take new Medicare patients. I'm going to tell my existing Medicare patients, sorry, I don't take that insurance anymore. Well, 1965, when Medicare and Medicaid were passed, the whole idea was to guarantee access to health care for older Americans and for the poor. And now we're starting to see that basic premise erode a lot. When I went to medical school, I learned nothing about anything like ICD coding or CPT coding or how healthcare is financed and paid for. I learned a lot about it after I got out of medical school. Things haven't changed in the last 35 or 40 years. You still go to medical school, you go through your residency, and then all of a sudden you get thrown out and told, by the way, in order to generate the income to pay your salary if you're on salary, or to generate your paycheck if you're on some kind of a productivity base, you have to do the following. It's like, huh? For most physicians, and the medical schools have not historically done a very good job of it. Some of the residency programs, family practice for example, now requires as part of the residency some education on the business aspects of practice, but most residencies still don't, and most medical schools don't address the issue at all. So yeah, when I was in med school, they said if you master the art and science of medicine, you'll be a great doctor. today, if you don't at least understand the art, the science, and the business of medicine, it's hard to be a very good doctor. For one thing, physicians have got to be activated participants in the political process, and too many physicians sit on the sidelines and figure somebody else will take care of lobbying their congressman. Send a letter. Actually, I take that back. Send an email. Letters don't go through anymore, but send an email to your congressional delegation and tell them they got to fix the SGR problem, because the longer they postpone that, the more uncertainty it creates and the harder it is to get on with our business. The other thing, though, is I think physicians have to really take a serious look at what is in the best interest of their practice and their patients. Should they continue to be a participating physician in Medicare? Can they afford to say, no, I won't be a participating physician in Medicare? Those are decisions they're going to have to start making for the next calendar year pretty soon. And they need to do it in as informed a way as they possibly can.
Now that you've heard what the MGMA conference attendees have to say, we want to know what you think. Click on Share Your Perspective at MDNews.com to let us know.